hyaluronic injectable that's capable of giving a smoother, natural-looking, glass-like appearance to the skin with an overall facial glow. Hi, I'm Dr. Messina, and I'm very excited to be discussing Allergan's latest product, SkinVive. FDA approved for use on the cheek. And unlike other hyaluronic acid fillers, such as Juvederm or Voluma, where you get an increase in volume, SkinVive doesn't do that. Instead, SkinVive is injected into a slightly different plane, the superficial dermis, where it attracts water, and it actually boosts your skin. That's the latest in rejuvenation, skin boosters, or telomere augmenters, things that actually cause rejuvenation from within, and not simply by placing a product in that expands the area. This is truly revolutionary, and I am quite excited about it. And if you watch my videos, you'll notice that in general, I tend to talk about a lot of the negative things because this field tends to overpromise. However, in this instance, I am very excited because I think SkinVive is the real deal, and I'm going to tell you why. When we use SkinVive, we make a grid on the cheek, anywhere from a ½ centimeter to a centimeter square, and in general, 10 to 20 little squares in this area down to the corner of the mouth. And in each square, microdroplets of this product are given. And they're given in the superficial dermis, so it leaves a little bit of a bump or a little bit of a bleb. And in time, it's going to absorb water, expanding the skin, hydrating the skin, reducing fine lines and wrinkles, and giving you this glass-like appearance that many patients say gave them a facial glow. I want to get into that because the glow part is what really piqued my interest. Many times when there's a tag phrase associated with a product, it comes from some back room somewhere with a bunch of ad people coming up with catchy phrases. However, in this case, during the FDA trials, they asked all the participants, "How was your face after the treatment?" And many of them said, "I feel that my face has a glow." So that's an honest answer, and that's what excites me. These patients actually felt that they had a glow, and indeed, they probably did. So when can we use SkinVive, and when should we not use SkinVive? It's very similar to the other hyaluronic acid fillers. If you have an allergy to it, if you are on anticoagulants, you might want to be a little careful, even if you're on something as simple as Motrin. If you have a problem with making hyperpigmentation, for instance, if every time you get a hypodermic needle, it creates a little dark spot, you might want to think twice, because unlike a dermal filler where you might be going through 1, maybe 2 entry points, this you're going to have between 10 and 20 entry points per side. So that's something to think about. You shouldn't do it during pregnancy or when you're breastfeeding. So what makes it different than other hyaluronic acid fillers? Well, one, its properties. First off, it's going to be injected into the superficial dermis, as we see here. Now, dermal fillers such as Juvederm are supposed to be injected into the dermis. How studies have shown, though, that very rarely is it actually in the dermis, and many times it's in the hypodermis, below the dermis, or even in the subcutaneous fat. SkinVive must be placed in the superficial dermis, which leads to some problems that I'm going to be discussing in a moment. What are some of the precautions we should take before getting the treatment? Well, aside from the list that I just gave you, sterility is very important. So your face should be prepped appropriately, washed with probably some Hibiclens and then alcohol, or even betadine followed by alcohol. The reason why is there's going to be multiple injection sites, and there's always a potential for an infection. Then you have to be careful of what you want to do after you have your treatment. After you have your treatment, this product is going to be sitting very superficially in your skin, and it's probably going to be sitting there for quite a while. Therefore, anything you do to the surface of your skin might have a profound impact on this SkinVive. Therefore, I wouldn't do any chemical peels or any laser procedures, something even as simple as laser hair removal or an IPL, photofacials. All of those things could disrupt this hyaluronic acid filler. Not only disrupt it, it can also create the potential to cause tremendous irritation in the skin. Therefore, if you're going to do laser procedures, do them before the SkinVive. And if you're going to do it after the SkinVive, at least 1 month after you get your injections. So how many syringes are we going to need to get this great result? Well, according to the FDA study, up to 6 syringes were given. I personally think that's a lot of syringes. I would recommend 1 syringe per cheek and then wait a month and see how it looks. You could always add a 2nd syringe or even a 3rd syringe at a later date. But 6 syringes is the maximum that they recommended at this current time. When are we going to see the results? Unlike dermal fillers such as Juvederm, which give you volume and take away a wrinkle or a fold in the skin immediately, SkinVive is a different process. It's going in your dermis, it's going to attract water. That water is going to expand in the skin. It's going to hydrate your skin extremely well. Therefore, it's going to take approximately 1 month to see the difference. And it should last about 5 months. Is your treatment painful? The treatment is no more painful than getting a regular hyaluronic acid injectable. In fact, it has lidocaine in the mixture. So once it's in the dermis, it's going to numb that area. You can put topical numbing cream on if you want, but numbing creams are not really that good at blocking a sharp pain such as a needle poke. Therefore, it's only going to help so much. So anesthetics, topical anesthetics are really not required. It's mixed into the formulation already, and it's already not that uncomfortable. So what can you expect after your treatment? Well, it's not going to be the same as a dermal filler, where hopefully you don't have any bleeding or bruising. Instead, after SkinVive, you're going to walk out reddened. You're going to have little bumps and blebs all over your cheeks, going around to the lower corner of your mouth. That's going to last for a few days. It might feel itchy, it might feel dry, and it might feel a little tense. All of these side effects tend to resolve in 1 week or less, many resolving in 48 hours. So you're not going to go home from a SkinVive treatment and nobody's going to know. When you get a SkinVive treatment, you're going to see some evidence that you had multiple small injections in your cheeks. Now these injections are very small. The needle is tiny. It also comes with 4 needles, which means that when I'm doing it, I replace the needles twice per cheek. It makes it more comfortable because the needles are not designed to be poked into the skin 10, 20 times. They're really designed for 1 poke. So what I tend to do is halfway through, change it to a brand new needle. It makes it more comfortable and it comes in the packet already. So I hope you learned something about this wonderful treatment. I think it's really revolutionary. I think it's working by a totally different mechanism of action. That skin boosting, using hydration to actually give an effect, I think is so much better than putting something in there that artificially creates this effect. Now you can help it, of course. Stay well hydrated. People will say, do I have to hydrate after I do this? Yes. It's like the diabetic taking their insulin. They shouldn't go out and eat a gigantic piece of cake, insulin or not. Same thing with this. You're getting a skin hydrator, but it's important to also take adequate oral hydration as well. So continue with your fluid management as you were before you got the treatments. I hope this was interesting for you. I hope you try the SkinVive. I'm sure you're going to enjoy it as much as I'm enjoying doing it. Take care. Have a good day.